Antidepressants play a crucial role in treating depression and anxiety disorders. However, there is growing concern about their overuse and the potential negative consequences for those who may not need them, as well as being harmed by them. This can lead to physical and psychological adverse effects and even misallocation of valuable healthcare resources, affecting both patients and the healthcare system as a whole. In this video, we're going to take a dive into the controversy surrounding the overprescription and inappropriate prescribing of antidepressants. And who am I? My name is Dr. Sulman Aziz Mirza. I am a triple board certified psychiatrist specializing in adult psychiatry, child and adolescent psychiatry, and addiction medicine. Thanks for watching, and if you're enjoying, please remember to like and subscribe to the channel, where we do deep dives into various medications and controversies within the field of psychiatry, and where I do host a podcast as well, interviewing leaders within the field. Over the past few decades, there has been a significant increase in the number of antidepressant prescriptions. According to the CDC, the Center for Disease Control and Prevention, between 1999 to 2014, the percentage of Americans using antidepressants rose by nearly 65%. Today, antidepressants are among the most commonly prescribed medications, with millions of people relying on them to manage their mental health. There are several factors that may contribute to this rise in prescriptions, one of which is the increased awareness and recognition of mental health conditions like depression and anxiety. As society becomes more open to discussing these issues, more people are seeking help and receiving diagnoses, which in turn leads to higher prescription rates. We've become, in a way, a victim of greater mental health awareness. Another contributing factor is the influence of pharmaceutical marketing. In an effort to promote their products, pharmaceutical companies often engage in aggressive marketing tactics, targeting both healthcare providers and the general public. This can create a demand for their medications and influence prescribing practices, potentially leading to an over-reliance on antidepressants. I often have patients who will come and say to me, "Dr. Mirza, I saw a commercial for this medication. Is that a good option for me?" Finally, we cannot overlook the role of the healthcare system itself. With limited time and resources, healthcare providers may sometimes opt for the most accessible and time-efficient solution, which can mean prescribing medication over exploring alternative treatments like therapy or conducting more comprehensive assessments. It's estimated that in the United States, between 75 to 80% of antidepressants are prescribed by non-psychiatrists, the doctors who are the experts in these medications like me. This is primarily due to a severe shortage of mental health professionals across the board. When antidepressants are overprescribed or inappropriately prescribed, patients may experience a range of physical and psychological side effects. Some common physical side effects include things like weight gain, insomnia, dizziness, and gastrointestinal issues. One of the most common reasons that people stop taking antidepressants is due to adverse sexual effects, which are not uncommon but are often transient. There has been a greater awareness and recognition that there is a rare group of people who may experience a phenomenon known as PSSD, or post-SSRI sexual dysfunction, which can last even beyond when the offending agent is stopped and is potentially permanent. Psychologically, patients may experience things like emotional blunting, increased anxiety, or even worsening depression. It's essential to weigh the potential benefits of antidepressant use against these possible side effects, particularly when the medication may not be necessary for the individual. Another concern is the risk of discontinuation syndrome symptoms when they attempt to discontinue their use of the medications, or which may occur when we miss a dose on accident, which is a totally human thing to do. This can make it hard to stop taking the medications even if it is no longer needed or if an alternative treatment would have been more appropriate. Overprescription of antidepressants can also lead to the misuse of healthcare resources and increase healthcare costs. When medications are prescribed unnecessarily, it can result in higher spending on prescription drugs and increased patient visits for side effect management. Moreover, overemphasis on pharmacological treatment may divert resources away from other effective treatments such as psychotherapy or lifestyle interventions, which could potentially provide better long-term outcomes for some patients. As mentioned earlier, pharmaceutical marketing can play a significant role in influencing prescribing practices. Companies often invest heavily in marketing their products, targeting healthcare providers through sponsored conferences, free samples, and promotional materials. Additionally, direct-to-consumer advertising, such as commercials on TV or print ads in magazines, can create a demand for specific medications, leading patients to request them specifically from their healthcare providers. Diagnostic biases and the potential for misdiagnosis are another concern. Mental health diagnoses can be complex, and there is often overlap in symptoms between different disorders. As a result, patients may be misdiagnosed and prescribed antidepressants when another treatment would be more appropriate, such as investigating whether something like ADHD or autism or trauma is causing the symptoms. We need to use improved diagnostic tools and comprehensive assessments in order to minimize these potential risks. One of the things I commonly bring up are time constraints and limited resources in healthcare settings, which can also contribute to overprescription. With busy schedules and a high patient load, healthcare providers may not have the time to conduct in-depth assessments or explore alternative treatments. In these situations, prescribing medication can be seen as a quick and efficient solution, even if it may not be the most effective course of action for the patient. Lastly, society itself and the desire for quick solutions to complex mental health issues can fuel the overuse of antidepressants. In our fast-paced world, people may be more inclined to seek immediate relief from their symptoms rather than address the root causes of their distress. This mindset can perpetuate the belief that medication is the primary solution to mental health issues, leading to overprescription. Accurate diagnosis is critical in mental health care. Proper assessment and diagnosis not only ensure that the patients receive the most effective treatment for their specific condition, but also helps to avoid the potential risks and side effects of unnecessary medications. Healthcare providers must be thorough in their assessments, taking the time to consider the full range of symptoms, the patient's history, and any other relevant factors that could inform the diagnosis. There is absolutely a difference between a primary care doctor doing a 15-minute visit and saying at the end, "Hey, let's try an antidepressant," and what I do when I spend time with my patients, 60 to 90 minutes with them, before arriving at a shared decision in regards to medication or other treatment options. Alongside accurate diagnosis, it's essential for healthcare providers to consider alternative treatments and personalized approaches to care. While antidepressants can be a powerful tool for managing mental health issues, they are not always the best or only solution. Other treatments such as psychotherapy, exercise, and lifestyle changes can be just as effective for some patients, and in many cases, a combination of approaches may yield the best results. By taking this more individualized approach to treatment, healthcare providers can help ensure that patients receive the care that they truly need, ultimately reducing the risk of overprescription. One of the first steps in addressing overprescription is encouraging more comprehensive mental health assessments and improving the diagnostic tools. This includes developing standardized assessment protocols, refining the diagnostic criteria, and investing in research to better understand the nuances of mental health disorders. By ensuring that diagnoses are accurate and evidence-based, we can reduce the likelihood of unnecessary or inappropriate prescriptions. It's also crucial to advocate for better education and training for healthcare providers on prescribing practices. This includes providing ongoing education about the latest research, guidelines, and best practices for prescribing antidepressants. By empowering healthcare providers with the knowledge and the skills to make informed decisions, we can help ensure that medication is prescribed only when truly necessary and appropriate. Promoting public awareness about the risks of overprescription and the importance of seeking appropriate care is another essential step. Educating the public about the potential side effects of unnecessary medication use, the value of accurate diagnosis, and the availability of alternative treatments can help empower individuals to make more informed decisions about their mental health care. Finally, we should consider the potential for implementing regulatory measures to curb pharmaceutical marketing practices. By creating policies that limit the influence of marketing on prescribing practices and ensure that healthcare providers receive unbiased, evidence-based information about medications, we can help reduce the pressure to prescribe antidepressants unnecessarily. Wrapping up, it's essential to recognize the potential risk associated with overprescription and work collectively towards a more responsible and effective approach to mental health care. As a viewer, I encourage you to be proactive in your mental health care and engage in open conversations with your healthcare providers. Ask questions, discuss alternative treatments, and ensure that you're receiving the care that is most appropriate for your specific needs. Let's continue to push for more research, education, and awareness on the issue of overprescription of antidepressants to improve the overall quality of mental health care. If you found this video informative and valuable, please like, comment, and subscribe to the channel. Your support will help us to continue to create content that promotes a better understanding of mental health and its complexities. Thank you for watching, and let's keep the conversation going. Comment below.